Great. So we'll start getting the next panel up and mic'd. This will be the payer perspective on the treatment of obesity. And we have three great panelists. Again, I encourage you to look at their bios in your program. The first is Tom Perry, who's the president and co-founder of Integrated Benefits Institute, which is a San Francisco-based organization that's independent and not-for-profit that looks at benefits and looks at the impact of things like obesity. The membership of his institute is over 1,100 organizations covering about or employing about 20 million people. And that 90% are employers. So as opposed to having a patient look at this, we've got an employer view of paying for obesity services. Second is Bryce Williams, who's the Vice President for Well-Being at Blue Cross Blue Shield of California. He's actually worked in several Blues, Massachusetts and Highmark, doing similar work. That he'll talk a little bit about a program that he helped lead at Blue Cross of California, which is called Wellvolution. I'll let you pronounce that. And finally, we have Deidre Stockman, who's the lead for secondary prevention in the Division of Quality and Health Outcomes at the Center for Medicaid and CHIP Services in CMS. And again, she's done a number of things working in quality metrics related to obesity. Now, what I'm going to do is give you a quick orienting view of coverage of weight management. This is going to be very quick, and the slides will be available afterwards. The first point with regard to payers is that there is a hook for coverage of treatment services for obesity in the Affordable Care Act, and at least we still have the Affordable Care Act at the moment. And these for both adult and pediatric services. The second point, though, is that the coverage is variable by state. The actual coverage of obesity treatment services are determined by, in a number of ways in a particular state. It can be the most prevalent PPO plan. It can be specific things identified, but it is highly variable across the country. In terms of how payers think about covering services, it's not just the money. There are many things that go into determinations. The first is whether customers demand or have a preference for a service. The second is how much does it cost, both in terms of is it expensive or not, but also whether the cost is predictable. And the fee-for-service world is one of the issues that arises there. There's concern about whether a service is considered evidence-based, effective, and efficient. And we've heard a lot about that this morning, which I think is really helpful. Next is whether you can deliver outcomes, particularly for health plans. They're measured oftentimes by NCQA or CMS-type metrics. And then can they develop a network to actually deliver the services? In addition, there's patient satisfaction. How well can we administer a particular benefit? There are concerns about compliance, and again, it comes back to essential health benefits, and then health insurance in a large part is about risk. And then finally, profitability and margin, and I would say that that's at the bottom of the list, at least initially. Now, I also wanted, since Medicaid is a big government payer, I wanted to note a couple things about Medicaid coverage up front. So the slides I'm going to present are not from CMS. They are from the Stop Obesity Alliance in work they did in 2014. The slides were not generated nor endorsed by CMS. I'm doing one of these disclosures. And then the essential health benefits from the Affordable Care Act actually do apply to Medicaid programs. So these are 2014 slides. We may have seen some evolution over time. That said, let's take a quick look. So the first slide is where we have Medicaid expansion. And again, you can see that there's the red belt and the blue belt here. Medicaid services have been expanded in the blue states, not in the red states. In terms of coverage for nutrition consult services, blue tends to mean coverage, red means no coverage, orange is somewhere in between. So you can see, again, there's a lot of variation in Medicaid around coverage for nutritional services. When it comes to disease management or educational services, there's very little coverage across the country, a number of kind of partial coverages as shown by the orange states. When it comes to obesity drugs, again, a lot of red here, very little coverage in Medicaid plans for drugs. But when you look at bariatric surgery, actually 48 out of 50 states do cover services in Medicaid, cover services for bariatric surgery. So with that, I'm going to move on to the panel and have Tom talk to us first.